Today I'm going to be presenting on a case study of Ed. Ed is a 78-year-old male who suffered from a stroke in the right hemisphere of his brain. He is married and has 2 middle-aged children. His wife Yvonne is his primary caregiver and assists with whatever needs he may have. His primary diagnosis was an acute cerebral infarction in the right hemisphere of his brain, specifically being an infarct involving the right posterior basal ganglia and periventricular white matter. Some primary pathologies of a stroke are cardiac embolism, aortic and carotid atheroma, small vessel disease, intracerebral and subarachnoid hemorrhages. Some risk factors of a stroke are hypertension, hyperlipidemia, atherosclerosis, diabetes, and also some lifestyle risk factors include smoking, alcohol use, drug use, lack of exercise, and also unhealthy diet. Many stroke survivors suffer from cognitive and physical limitations after having a stroke. They also may result in hemiplegia, hemiparesis, problems with attention, problem solving, learning, and they can also have emotional problems like depression and anxiety. Some comorbidities that Ed presented with were hypertension, hyperlipidemia, and a hernia. These will be addressed as precautions during the intervention process. Some client factors and limitations of Ed's are hemiplegia, hypertension, spasticity, mild dysarthria, visual acuity decreased, diplopia, mild cognitive impairment. He is also at risk for falls and presents with oculomotor dysfunction. Ed values spending time with his family and going to church. Prior to stroke, he enjoyed playing ping pong and tennis, but due to the limitations, he is unable to do that now. In the present, he enjoys bird watching and photography. Since Ed does not do a lot and has many limitations, his daily routine is pretty bare. It includes brushing his teeth, washing his face, eating breakfast, watching TV, and toileting, using the bathroom, and then also sleeping. Some occupations that Ed enjoys to do or is engaging in is church once a week. He manages his medications accurately and also likes to watch TV or the computer. Some of Ed's past roles is a driver. He is unable to do that due to the limitations. He was a cancer research scientist but is now retired. Some performance skills that Ed is able to do is opening and closing medication containers, following verbal, written, and demonstrative instructions, ambulating effectively with a narrow base quad cane, and also engaging in a home exercise program. For Ed's treatment interventions, we created interventions that increase his independence with self-care tasks, functional mobility, a home exercise program, and increases his memory, attention, and problem-solving skills. To determine Ed's functional status, we did administer 13 assessments. The first one being the Modified Barthel Index, Functional Reach Test, Stroke Impact Scale, Vital Signs, Borg Rating of Perceived Exertion Scale, Home Safety Assessment, Hand Function Screen, Manual Muscle Test, Range of Motion, Posture and Alignment Assessment, Visual Analog Scale for Pain Management, and Visual Perceptual Assessment. The Modified Barthel Index is used to measure the ability to complete 10 basic activities of daily living. These are chair bed transfers, ambulation and wheelchair, stair climbing, toilet transfer, bowel and bladder control, bathing, dressing, personal hygiene, and feeding. At the top left, I have provided a table of the different levels of independence. First one being 0 to 20 is total dependence, and lastly, 100 is complete independence. And based on Ed's modified Barthel's index score, he got a 65, which puts him at a moderately independent level. Goals are made to create a clear understanding of the patient's needs and desires. We have created 4 different short-term and long-term goals. First one being, client will provide returned verbal instruction on home safety management and assessment. Client will participate in self-care tasks such as donning and doffing socks to improve performance in dressing and grooming. Client will sustain attention for 30 minutes during a therapy group session for stroke survivors. Client will trial electrical stimulation to open or close 3 different containers with physical assistance as needed. And our long-term goals, the client will improve range of motion and strength in the left upper extremity within a 12-week time frame. Client will improve independence with dressing tasks shown by improved modified Barthel index dressing score. Client will report 0 falls within 12-week time frame. And lastly, the client will provide return demonstration of independence with home exercise program that includes strengthening, balance, and task-specific training within a 12-week time frame. And those are my sources. Thank you.